Last year, Milwaukee County ranked second in the state for the number of ER visits due to asthma. The American Lung Association in Wisconsin decided to do something about it. Partnering with United Health Foundation, Partners for Asthma Action was born.
The quality improvement portion of the initiative is a collaboration between the ALA in Wisconsin and area hospitals and clinics. We really work on improving the care given to asthma patients. The overall goal is to make sure that our patients are leaving with the correct education and the resources to manage their own disease. And ultimately, if they can manage their disease, it'll reduce the burden and the cost on the healthcare system.
What we've learned through this collaborative is that when we work with families, we make sure that they know that they are in partnership with us, that we are there to support them as they learn the journey around how to self-manage their asthma.
All of the resources that the American Lung Association was willing to provide were precisely the resources we needed at that moment to continue our journey for quality improvement.
In 2015, data compiled created a target list of the highest utilizers of 911. Some people called more than 40 times in a 6-month period. A disproportionate amount, 24%, of calls were due to asthma and difficulty breathing.
The American Lung Association and the Milwaukee Fire Department have partnered with their community paramedic program, and I go out on home visits with the community paramedics, and we do home assessments. We assess their homes for asthma triggers, and then we're able to provide the supplies that they need to get rid of the triggers.
This isn't just about their asthma. It's about the other social determinants of health and everything else that surrounds their medical problem. Because we're welcome in their environment, we're comfortable sitting there and pointing things out, and they don't take offense to it. It just helps us get the resources that have always been available into the patient's home, and they feel comfortable letting us introduce those resources to them.
Asthma is the leading cause of school absenteeism due to chronic illness.
Kids are not in their seats in the school, they're not learning. But also if they're having problems within the school, either if they have exercise-induced bronchospasms where they're out on the playground or through gym, when they come back and have those health concerns, they're not focused on their learning because they're more focused on how they're feeling, or they're scared, or trying to manage their symptoms in the school.
In the last 6 months, 25 children completed in-school asthma education programs. 10 homes have had trigger remediation. More than 100 healthcare professionals were trained.
You always have asthma, it never goes away. So really giving them the power to say that to their teachers and faculty, and knowing how to control that. I think once they know that they can control it and avoid having to go to the emergency room and avoid having it get to that point, their level of fear goes down because they know that they can manage it.
The sharing of what we've tried and what other organizations have tried has really been in the spirit of this learning collaborative, which has really been remarkable.
It was like Christmas, because all of a sudden there was a program that would support us in that component, that part of our quality journey. And now I'm confident that we're going to be able to show better compliance with medication as a result of our partnership with the American Lung Association.
The American Lung Association in Wisconsin thanks United Health Foundation and all of our partners for helping people with asthma breathe easier.